So you can do like anti-clockwise this way or clockwise for 20 times each.
Hi everyone, welcome to AskMeDoctor Season 3, a health video series for you and for your family. I'm Syahira from motherhood.com.my. Do you know that pregnancy-related back pain is often localized to a specific area of spine and not widespread? Back pain tends to arise between the 5th and 7th months of pregnancy. Though it can begin much earlier, it is common but not normal. It should not be taken lightly. Today, we are very fortunate to have a WEBSTER Certified Prenatal Chiropractor from Chirozone Family Chiropractic, Dr.Joo Yi Ong, to help pregnant mothers understand better how to take care of their spinal health. Hello Dr. Joo Yi, how are you today?
I'm good, Shazni. How about you?
I'm good too, thank you. Alright doctor, I think a lot of pregnancy mothers out there have lots of questions about their weight, their back pain and things like that. So we have prepared a few questions for you today. So let's start with our first question.
Sure.
Other than weight gain, what are the other factors that cause pregnant mothers to experience back pain during pregnancy, doctor?
So the first thing is the mom's posture change during pregnancy. The center of gravity shifts forward, which causes the moms to have anterior pelvic tilt to accommodate the growing baby. So in order to regain the balance, some women will actually lean back, but this will actually put extra stress and strain on the lower back muscles, which can cause spasm and lower back pain, because their muscles have to work harder in order to support their baby's weight. So the second cause of lower back pain during pregnancy is the hormonal changes. So these relaxin hormones, they actually help to relax the muscles and ligaments near the pelvis so that the birth canal can expand during delivery, which can also affect the stability and the alignment of the joints. So this instability can actually cause the joints to misalign easily, which can cause lower back pain. So the third cause of lower back pain during pregnancy is pelvic misalignment. Okay. Instability of the joints can cause misalignment in the pelvic, therefore leading to pain and inflammation. One side of the pelvis is either rotated forward or higher as compared to the other. So when this happens, the pelvic is not in the right balance and causing lower back pain.
Okay doctor, so does all these causes tend to let the mother walk slightly slower? You know, some mothers like holding their back when they walk, and also some mothers have very hard to sleep at night. So does this actually cause them to experience that?
Yes, so pelvic misalignment is one of the main factors that pregnant moms will have pain during, walking, standing, prolonged standing, or even sleeping. They can't really seem to find a proper position to sleep. So if it is due to a pelvic misalignment, be sure to actually get it checked by a certified prenatal chiropractor.
So moving on to the next question, doctor. What are the exercises that pregnant mothers can do to relieve the pain?
Yeah, sure. Let me demonstrate a few exercises for you guys. So during pregnancy, if you do have any pain or discomfort, you can actually do a few exercises to help relieve these pains. The first exercise that you can do is you can get a gym ball and you do pelvic rotations. So you can do like anti-clockwise this way or clockwise for 20 times each. But by doing this, make sure your upper body is upright and not tilting forward by doing this, or you're not swaying your hips too much to the sides. Just make sure that your spine is upright and then just do gentle movements like this. Okay. So the second exercise that you can do is a child's pose stretch. So you can do this and try to give space for your bum. Open up your legs a little bit wider and slowly stretch forward this way. You should be feeling a gentle stretch across your lower back. Hold it for about 20 seconds. And you can do it 3 to 5 times. So the third exercise is a cat and camel stretch. Be on all fours. Now slowly raise your upper back up this way. You feel a gentle stretch across your spine and breathe out. Lower your lower back this way. So you should feel a stretch across the spine as well. Do not arch your lower back too much by doing this, as it will injure your back. So make sure it is just a gentle movement this way. Okay, you can do it for about 20 times each day. So if you have back pain, be sure to try out these exercises to help relieve the back pain.
That's very interesting. I think these exercises are very easy for pregnant mothers to do at home. So let's move on to the next question. What should pregnant mothers do to ensure that spinal health is in good condition? I mean, how can they protect their back, doctor?
So the main important thing for mom is to watch out their day-to-day posture. For sitting, do not slouch, sit crossing legs, or even sit on the floor. Try reducing sitting on the floor, as this will actually cause a lot of pressure on the lower back and the pelvic joint. So while sleeping, try sleeping on the side with a pillow in between your legs to help keeping your spine straight, and do not rotate your upper leg towards the other leg by keeping and minimizing the rotation in your pelvic joint. So for lifting, be sure to engage your core and your buttock muscles. Always straighten your lower back spine. Use your thigh strength and bend it forward. Keep your back straight and lift up instead of bending at waist. It is also recommended for pregnant moms to do brisk walking every day for 30 to 45 minutes to strengthen the lower back muscles. So if you have done and practiced all of these good habits, but if the pain still persists, you should seek help from a certified prenatal chiropractor to assess and identify the root cause of your pain.
So doctor, just now you talk about lifting, right? So do you recommend for mothers to actually carry their other children, for example toddlers, because they are quite heavy? So does that can cause any back pain?
So when you're pregnant, but if you still have to lift your toddler, be sure to use the correct lifting technique. Engage your core and always use your glute muscles to carry your toddler. Make sure your spine is in a straight line. Don't ever tilt your pelvic to the side or tilt it forward just so that you can accommodate your toddler.
I think a lot of moms did that. I did that too, tilting the baby to the side even after pregnancy once the baby is out. For example, if the baby is around 1 year old, I think a lot of moms tend to actually tilt their body to the side to hold the baby. That's not good, doctor?
So of course that is not good, because that's going to tilt your pelvis even more and causing a lot of strain around the surrounding muscles.
On to the next question, doctor. So is it safe for pregnant mothers to have chiropractic sessions during pregnancy?
Yes, generally chiropractic is very safe for the pregnant mom and the baby. Be sure to look for a certified chiropractor, or you can also look for a chiropractor who has additional training in treating pregnant moms. We always look for the root cause and diagnose the problem first before we proceed with any kind of treatment. So here in Chirozone, we utilize the WEBSTER technique, which is specifically designed for pregnant moms. It is safe throughout the whole pregnancy, from the first trimester all the way to 42 weeks of pregnancy.
So during these sessions, what are the processes of WEBSTER prenatal chiropractic treatment? What pregnant mothers can expect?
So every mom comes in with different conditions. So the first visit, we're going to do a thorough and detailed history taking and assessment to understand their condition better, like their lifestyle, their daily activities, their pain intensity, and more, also to check what is the root cause of their pain and their discomfort. Then we will explain to the mom what's going on and how we can help them with their back pain or groin pain if there is any. From there, we will proceed with the treatment. The whole treatment process for pregnant moms is very gentle and specific to target the root cause of their pains, such as their pelvic pain, their groin pain, their buttock pain, inner thigh pain, and more, to help them feel better and relieve their pregnancy-related discomfort. On the other hand, even if you do not have any pregnancy-related discomfort, but if you would like to achieve a higher chance of natural delivery, shorter labor time, or better fetal positioning, prepare your body for labor. Here at Chirozone, we utilize the WEBSTER technique. So some moms that we see do not actually experience any back pain or pregnancy-related discomfort, but would just like to prepare their body for a smoother delivery experience. So, as much as our prenatal chiropractic care helps moms to have improved back pain, it also helps the baby to be in the best possible position for labor.
Wow, that's great! I wish I knew that earlier for my previous pregnancy. Before we close this, is there anything you would like to add, doctor?
So it is common to have back pain during pregnancy, but it is not normal if it is starting to affect your daily activities. So if you have the symptoms below, such as when you are sleeping, you can't really seem to find a suitable position to sleep, or when you get up from the bed, you need your husband's help because it's too painful, or when you walk up the steps, or when you wear your pants, it's creating a lot of pain in your pubic area, or if you have the buttock pain that radiates down to your back of the thigh. So these are the warning signs that you should start seeking care from a health professional. Or if you would like to increase your chance of natural delivery, achieve shorter labor time, you can also consult with our prenatal chiropractor.
Well, I hope you enjoyed this episode and learned as much as I did. Stay tuned for the upcoming videos on Ask Me Doctor. Thank you for watching our video. I'm Abdullah.
I'm Joo Yi.
And we are from motherhood.com.my. Bye! Bye!